What's red hot now? Try mobile health. Today it's a market worth $13.5 billion, but estimates place its growth near $63 billion in just 4 years. When you think of all the companies that capture patient-generated health data, you need to think Validic, a company whose connection platform receives patient-generated health data from more than 400 major sources, collectively reaching 223 million individuals in 52 countries. Today we have Drew Schiller, the CEO of Validic, to talk about mobile health, data sharing, and the big push into health consumerism. He's connecting with us, and we're connecting with you, right here on Red Hot Healthcare. Let's go!
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Guys, welcome to the show. Today we've got a great guest. It's the CEO of Validic, Drew Schiller. And the story is, in 2010, he and co-founder Ryan Becklin wanted to create a startup that could better help the health system connect with a healthcare population. Hey, they've done just that. Validic has brought in drug companies, health systems, payers, medical device manufacturers, and lots of wellness companies. The ecosystem they have enables what they call a one-to-many connection between leading health organizations and most digital health technologies globally. Drew, it's a privilege and pleasure to have you on. I want to welcome you to Red Hot Healthcare.
Thank you so much, Steve. Glad to be here.
Well, it's great to have you on. I know that we've met down at HIMSS recently, and we've had some great conversations on the phone, and I've been looking forward to this as well. The first thing I'd like to do is come in with what you make of the numbers that I led in with on the intro, that essentially the mobile health industry, it's now at $13 billion, but with an estimated compound annual growth, it's on pace to be at about $300 billion in the next decade.
Yeah, I mean, the one word that pops in my mind is opportunity. And what I'm so excited for is that we are seeing, you mentioned consumerism, and we are seeing so many consumer technology companies entering the healthcare space because of this opportunity. So Apple, Google, Samsung, Microsoft, these are the greatest technology companies in the world, even Amazon, that are now entering into this space. And what I'm excited for is that these are companies that are built on their ability to engage consumers in behaviors. And healthcare has traditionally been very poor at engaging patients as consumers, or even patients in their own healthcare. So I think that the combination of bringing consumer technology companies that have been built on engagement into healthcare that desperately needs to create more engagement and better holistic solutions, I think that's going to be just a really great match. And I'm very, very bullish and excited for what's going to happen over the course of the next 5 to 10 years.
Yeah, Drew, and you're not the only one. There's a lot of publications now, a lot of experts that are, like you said, really bullish right now on mobile and on patient-generated healthcare data. What I'd like you to do is to take the audience through the what and maybe the why of Validic.
Yeah, absolutely. So, when we started Validic in 2010, we were really looking at how can we engage consumers in their own health. And specifically, we were targeting the self-insured and employer population and how they could work with their employees to get them more engaged and happy and healthy in the workforce environment. We actually came out with a couple of products in that space initially. And the second product really started to look at exactly what you're talking about, which is how do we bring in all of these different device data options that patients might be, or that consumers might be using outside the four walls of healthcare, and bring that back in for the purpose of health engagement? And so initially the platform was, hey, bring in devices, and we use incentives from employers to actually incentivize the use of these apps and devices. And as we started to take that product out to market in late 2012, the folks we were talking to said, hey, we're already working on improving engagement across the board, but we don't have access to these devices. is there something there that we can actually license the device connection piece just from you guys so that we can kind of future-proof ourselves from what's going to happen? And then that way you handle all of the nitty-gritty, messy, dirty work. And we thought that's great because that's actually where we've been spending most of our time because it's a huge problem. So in 2013, when we launched Validic, it was with a very, very simple value proposition of, look, there's a growing amount of apps and device data that are being created by patients across the healthcare spectrum. Make one simple connection to Validic and we'll standardize and normalize that data and provide it to you. And you don't have to think about, what company is going to come out next, what new device is going to come out next, what companies might fail. You don't have to place bets on any one individual company. You can just place a bet on the future of digital health and consumer health in general. And so what we've learned is that that's been a story that has played really, really well in the self-insured employer space, as well as with the large payers. Of course, with the health systems, this is a big opportunity, as well as in the life sciences space with clinical trials and digital patient initiatives. So we've been very fortunate since we launched to see a great growth, and folks have really been taking to Validic. And our lot in the world is to not just make it easy to access the data, but also make the data very, very accessible and seamless for both sides. So make it as seamless as possible for the consumer to get the data into their healthcare system, as well as make it as seamless as possible for the folks in healthcare to actually consume the data and take action on it.
Yeah, I didn't realize that you all started off on the self-insured employer side. I thought that this was always your business model from the beginning. So I guess that leads me into the next question, Drew, which is, since you all started in 2010, obviously one of the major moments was taking that model and changing it according to what the market was telling you it needed. But are there any other major client wins or maybe some other nuggets to touch on here that were your major growth moments since the company started?
Yeah, we've had so many amazing growth moments, and I'll touch on just a few quickly here. One excellent signal that we had, both a signal to us that we were on the right track, as well as a signal to the market, was in April of 2015 when we secured a Series B investment from Kaiser Permanente Ventures. And Kaiser Permanente Ventures, which is affiliated with Kaiser Permanente, really invests in the future of healthcare, and a lot of their investment thesis is driven by what is happening in healthcare and Kaiser Permanente specifically. And so that was a huge signal to us that we were on the right track. And having Kaiser Permanente Ventures on our board has been really great as well. The second thing is, last fall we actually received a recognition from Frost & Sullivan, and they called us the de facto standard for connecting patient-generated health data into the healthcare system. And nice. that was a huge signal, and that was really wonderful to hear. And that was something that we've been working toward becoming that de facto standard, and really saying, hey, look, we make it fast, we make it simple, and it's a messy world out there in terms of what the data looks like and all the new data that's coming off of devices. And we work really hard, both with our customers in the healthcare system as well as with our partners on the device manufacturer side, to standardize the data and make it something that's actionable for everybody. And the third thing that was a really great moment for us was last summer we secured a pilot contract with the Office of the National Coordinator for Health IT in the U.S. Department of Health and Human Services. And they've actually been working with Accenture for the last 2 years around, it's a PGHD project, a patient-generated health data project, to understand how PGHD flows in healthcare, where the inputs are, and how it can actually improve patient lives. And Accenture was looking for a subcontractor to run a pilot demonstration, and Validic was selected as one of 2 pilot contractors to provide this demonstration. And we worked with Sutter Health along with that for a type 2 diabetic population. And it's been a really great pilot. It wrapped up at the end of March, and basically it's for type 2 diabetics, and we took glucose monitors, blood pressure monitors, weight scales, activity trackers, and nutrition apps. We brought in the data from all those disparate sources. The data went into the EHR. It flowed up through the workflow for the clinicians and the care managers to actually provide better patient care. And it was just a really nice holistic approach to how patient-generated data can actually be used in a clinical context in a meaningful way.
Yeah, and that sort of bridges into another question I have, which is healthcare consumerism, which consumerism seems to be another big buzzword now. And as we talk about not only patients needing to contribute data, but also recognizing the patient more as a true customer than maybe years past. I'd like you to go ahead, and I know that you're pretty hot on health consumerism, Drew. Maybe you can give just the audience an explanation of that term, what a health consumer is, and then maybe how Validic is addressing consumerism moving forward.
Yeah, absolutely. As patients are actually starting to have more of their own personal dollars be tied to their healthcare expenses with HSAs and with FSAs and other directed mechanisms, they're spending a lot more time thinking through, am I getting the care that I want? Am I getting the care that I deserve? And the healthcare consumerism is actually, it's enabling the patient to start to say, hey, you know what? I think I can actually go somewhere else and get better care. I can take my healthcare dollars and spend them somewhere else. One really great example of this, so I mentioned the ONC pilot contract. In that pilot program, one of the patients who is enrolled, it's a gentleman in his early 50s, we'll call him Michael. And he said, when he went through this program, we got to interview him at the end of the program, and he said, every single person in his family who ever turned 40 got type 2 diabetes. His father, his brother, his sister, his grandma, he turned 40, he got diagnosed with type 2 diabetes. There's nothing he could really do to avoid that. He said, look, I'm not fat, I'm not lazy. Like, I exercise 5 days a week, I eat really healthy, I track my glucose 5 to 7 times a day, but I've never been able to manage my A1C. And what he was doing before he was in this program, he actually was in a totally different health system, and the endocrinologist that he was seeing was managing his A1C with 120-day-old A1C tests, and then prescribing some sort of new diabetes or adjustment to his diabetes medication. The problem is that was old data. And so he said, hey, look, I'm tracking my glucose. Let me get that information to you in more real time. So he started to download a PDF every single month from his glucose meter manufacturer, and he would fax it in to the endocrinologist, who would, effectively look at it and discard it immediately because,
Right.
he didn't know what to do with the data. He didn't know how to process it or even if, the data was reliable. And so Michael got so frustrated that he left that endocrinologist and went to Sutter. And it was very shortly after he went to Sutter that this program became available, and he enrolled in this program. And he was extremely happy for the fact that the data actually, that he was collecting on a daily basis actually went into the EHR and was actually made available in a workflow for the clinician to view on a regular basis. And as an example of the proactive care he received for that change, 2 weeks into the program, the diabetic nutritionist for this program from Sutter called him and said, Michael, things are looking good. You're tracking your glucose 5 to 7 times a day like you should. You're exercising. You're eating pretty healthy. But what's going on between 7 and 9 p.m. at night? Because your glucose is spiking, but we're not actually seeing any food being logged. And so they started talking about it, and Michael said, you know what? I realized I'm a snacker. My kids are in college, but they live at home. And at night, we're watching TV, we're watching a game, there's chips, there's popcorn, I might grab a little handful. And he said, sure enough, I cut that out, and 30 days later, my A1C dropped by half a point. And that was
Isn't that amazing?
It was amazing. It was the biggest point that it was the biggest change in his A1C he'd ever had. And he didn't do anything different. He was still doing all the same things he was doing before with the old endocrinologist. The only difference was the data was getting where it needed to go and was connected.
This is Dr. Steve Ambrose. As a healthcare influencer, I'm in contact with some of the brightest minds and most powerful leaders in the industry. But my best effort comes from outside the booth. Knowing how to engage patients is an art, science, and philosophy that I know very well. I'm a hired gun that brings expertise to healthcare organizations of all types. You've heard my words. Now read my thoughts on my free white paper called The 7 Mistakes Made in Patient Engagement. Just go to redhothealthcare.com/learn. That's redhothealthcare.com/learn. While you're on the site, dive into my consulting and speaking services and schedule an initial call. You won't regret the uniqueness, benefits, and results I can deliver for you. And now, back to the show. Yeah, Drew, that's such an interesting story. I know that you mentioned to me that same story off the air, and it just still amazes me how here's a patient who essentially is really engaged into his own healthcare. I mean, essentially, he's what they call now an activated patient, but he didn't need to be activated. He sort of activated himself, and he fits beautifully into really what's a new trend and a growing trend in healthcare. Patient engagement, speaking of which, it's not only my area of expertise where I consult, but really it's just been proven to be a major factor in just better outcomes and lower long-term cost. Maybe take our audience into the relationship that you found between patient-generated health data and patient engagement.
Yeah, absolutely. When I think of patient engagement, I think of it's hard for me to think about patient engagement without being reminded of or thinking of the fact that patients actually don't want to be engaged as patients. What they really want to be is healthy. When I think of patient-generated health data in general and really the end goal is actually for us to have what I call an invisible healthcare system. And what that means is that we have technology that is invisible to the consumer to the point where it's not that you don't see it, it's just you don't notice it. It's just a part of your daily life. Patients will be engaged when they can just live their lives and healthcare moves out of the way. Let me give you an example of this. So do you have an Amazon Echo, Steve?
I don't yet, but that is on my birthday wish list, and it's coming up soon.
Great.
Just to let you know.
Yep. Good. So, when you first get your Amazon Echo, you're going to do what everyone else does, which is, you're going to go downstairs into your kitchen or wherever you place it. You're going to say, oh man, this is so cool. I can ask it to tell me a joke. I can ask it to tell me the weather or whatever. But then, after a couple of weeks, it's just a part of your daily routine. And you'll say, Alexa, set a timer for 20 minutes. Alexa, do I need an umbrella today? And it's just something, you still see the technology, but it's so seamlessly integrated into your life that it's something you don't even recognize, right? Or, you think about the fact that, we have technology that's in our lives every day that we don't even notice. For example, I have cameras on my car that indicate that there's someone driving in my blind spot. I have reverse cameras on my car to make sure that I'm not going to hit something and it beeps if I'm going to. These are all pieces of technology that were very, very cool at first and kind of gimmicky, but have become such a part of my daily life, and they were integrated so seamlessly that I don't even think about it. And I think that in order for us to truly engage patients in their healthcare, patient-generated health data and the devices and the way that we engage patients in the healthcare system have to move into that phase. We have to move into the phase where everything is designed so seamless into our lives that patients participate, and it's just something that's easy for them to do.
Yeah, Drew, those are great points. And I want to add something else here, and it's just a personal observation. Really, with regard to patient data, remote monitoring, one of the things that I'm noticing is, especially from mobile app companies and wearable companies, there's this marketing spin that's going on. And it goes something like this. 88% of all Americans have a mobile phone. 66% of all Americans look up healthcare information on the internet. Therefore, there's going to be a tremendous desire for everybody to download their medical records, to want to download their records, and also to generate and send a lot of their healthcare data. They're really going to be willing to do that. So, if you take away medical implants and focus on electable use medical devices, glucose monitors, perhaps digital scales, and some of the other apps for contributing patient-generated healthcare data, clearly, I don't see all patients and health consumers anxious to jump into supplying that data, at least right now. Maybe you can comment a little bit on some of the logic that it seems to be, some of the fuzzy math that seems to be out there.
I think that the device manufacturers have done a really solid job at identifying a problem, and they've actually done a good job of building a solution for the problem. The challenge is that they haven't actually solved the problem for the patient. So you can actually use these devices to, monitor your condition or to be healthy or to improve your health. The challenge is it's actually really difficult to use, and it's even more difficult to get the data into the healthcare system in a meaningful way. And so what I've seen is that in order to actually be effective, what patients need to be a part of is a program of health with their provider that incorporates these devices with a defined reason and goal for what they're trying to achieve. So, for example, in the O&C pilot I mentioned that we subcontracted with Sutter Health, for that diabetes pilot, these were patients who were taking their glucose readings, their blood pressure readings, their weight readings. They're tracking their meals with the nutrition app. And they had 100% compliance with this program. And this is because they were enrolled in a program of care. There was a defined goal that the provider and the care team and the patient were all on board with. And the care team knew exactly what they were looking for. And so the data that would flow from the patients came into the care management team's portal. And every morning a care manager could look at it and they would get a red, yellow, green dashboard of how their patients are doing. Green being everything is okay with this patient. Red being, hey, somebody hasn't taken a glucose reading in the last 24 hours. There's been 3 glucose readings in a row that have fallen outside of a range that are a little bit concerning. Maybe someone has tracked their meals and there's some concerning information there. But they had rules in there so that the care team could take action based on that. And if somebody didn't track their glucose reading, the care team knew immediately to reach out and give them a call and find out, hey, is everything okay? It might be that, is this something as simple as the device came out of sync, or it could have been something, more complex, such as, the patient had something else going on in their life and wasn't able to do it. So what we really need to do is look at this from a holistic perspective. This can't be a situation where we just have apps and device companies making a problem or making a solution to solve a problem for, collecting data. This has to be a holistic approach. And I would actually argue that we don't actually need any new innovation around apps and devices today. We're going to get new innovation and we're going to have amazing innovation and we're going to have more sensors and the technology that we're going to be receiving is going to be from these devices going to be better and better. We don't need all of that to make an impact on patients today. In the ONC pilot example that I gave, we did nothing different for Michael to actually improve his care and drop his A1C. The only thing we did was make the data accessible in a meaningful way, and he became an activated, engaged patient and absolutely got banner care that he, above and beyond what he ever would have expected.
Yeah, the only thing I would add to that is you take a guy like Michael, he's engaged because he sees value in it. He's making a decision because to him, it's important. And I think that a lot of what you're talking about, particularly in establishing the right programs and the coordination and the care teams along with the patient, are really needed. And I also really agree with you on the point that we don't need any more innovation. We have more than enough technology out there. But something at the core of it all, to me, still is missing. And I think that's what motivates humans to make change. What motivates them to make a decision? Because ultimately, we know how valuable it is to the medical device companies and to the companies that have mobile apps. It's very important to them because it's their livelihood. And I know how important it is to you because other than your livelihood, it's something that you and really I'm passionate about. But there's a lot of patients that need to be passionate and they need to value it. And to some extent, I still feel like that's a missing piece, that we haven't really targeted cognitively on what can drive something to be valuable and important. What's the trigger that's going to get them to say, I want to make this important. I'm going to take the time to do it and I'm going to follow through. Does that make sense or am I off the rails on that?
No, it makes complete and total sense. And in fact, when I talk with, my grandparents who are 86 and, very healthy for 86, fortunately, for them, there's an intrinsic motivator to be healthy and to do the things that they need to do to be healthy. My other set of grandparents, who unfortunately both have passed away, they did not have that. There was not that intrinsic, motivation to be healthy that was built in from an early age. And my grandma, who unfortunately passed away a few years ago from complications with COPD, I remember her telling me one time. She said, I got a new doctor. He's really young. He seems like he's still a teenager. He told me I need to lose some weight. What the heck does he know? Right. And there's so right. And so there is that point. And I think that first and foremost, I don't have the clear answer here. And I don't think anyone does have the one answer. But I don't think there is an easy one person answer. I think this is going to be an N of one answer. And I think this is also why the program of care matters, because when you are enrolling a patient in a program of care, up front, there's an assessment of, hey, why are you enrolling in this program? What are your personal goals for this program? Why is this important to you? And if it's not, then is this something you should really enroll in right now? Right? And it's an idea. So in other words, you're not thrusting healthcare on the patient, which is really how we've done healthcare in the past and how we've tried to manage chronic diseases. It's instead, it's including the patient in this and saying, is this something you actually want to do? Because if so, let's do it together and let's go hand in hand and let's make it happen. And if not, well, that's okay too. Let's figure out, is there something else that you're willing to work on?
Yes, right? That's a great point. It's the difference between pushing or forcing technology push versus a communication or an engagement pull. That's a great point that you just made right there. You just can't force technology on everybody just because it happens to be a solution. Like you said, it's not going to work for everybody.
That's right. As much as, look, I'm a technologist and I geek out on this stuff left and right on all of the patient-generated data stuff, and I try all the new wearables and a ton of the new medical devices. I personally just love it because I find this technology fascinating. But I'm not in the majority of the population. I think that a good percent of people are like that. But for those who aren't, we need to find other ways of getting them, engaged and interested in how to actually use that. And I think a critical piece of that is making sure the data goes somewhere that's meaningful.
Yes, absolutely. And as you said so well too, personalizing it, making sure it's not where you're just throwing this one approach or all this data at people and sort of saying, well, don't you get it? Like, isn't it hitting you? Doesn't it amaze you? Doesn't that make you want to just jump up and lose weight? It's, I was reading something from a cognitive behavioral specialist. It was very interesting. And she wrote a book, Andrea LaFountain. And essentially she says that there's so many diabetics out there, diabetic patients, that eat terribly, but in their mind, they take insulin. And they think, as long as I'm testing my sugar and taking my insulin, that's pretty much, I'm doing a good job of managing my condition. And in their mind, they've rationalized that that's good enough. And it's not important to really control their diet beyond that. The insulin helps and everything else and sort of gives them the ability to, not to slack off, but just not to make those other areas really important. And sometimes it's interesting. It's not just like the patient actions, as you were saying, but why are they taking the patient actions, Why are they not doing something? But I want to enter into something else that I thought was really amazing to me with Validic. You just entered into a partner relationship with Salesforce, which is really a non-healthcare company, but now they're jumping in, they're seeking to compete and integrate with electronic health record products and platforms. Maybe you could talk a little bit about that, and then maybe if there are other non-healthcare companies that Validic is partnering with right now.
Yeah, I'm glad you called that out. So this is a really interesting movement that we've seen in digital health, and I alluded to some of this in early on. The technology vendors that have historically been, large players, solutions providers, and infrastructure companies for other areas and sectors are now really moving into healthcare in a big way. So you mentioned Salesforce with their big overtures with Health Cloud. We also recently partners with SAP, which already provides, a lot of the technology infrastructure for health systems, but now they're looking at how can we expand into patient-generated health data and bring that into our HANA platform in a meaningful way. We're doing a lot of work with Microsoft, and they, have recently come out with a Health Vault app, the Health Vault Analytics offering an app in the App Store that provides a lot of amazing data that we're helping them with. And then Google is making amazing strides with Verily and the Google Cloud infrastructure. And so all of these tech companies that have solved problems in other areas are now looking to healthcare and saying, how can we bring our expertise and capabilities into healthcare and really help level up healthcare? And we see a data explosion in healthcare similar to what we saw in finance, in advertising, in all these other areas. So how can we actually help combine these? And so I think from healthcare's perspective, we should feel very honored to have this opportunity to leverage the biggest of the big companies who have already built big businesses on leveraging all of this data. And I think that, we're even seeing, IBM with Watson, we're seeing so many interesting things come out. And I think it's going to take some time for it all to shake out to determine, what's the thing, who are the winners and how exactly are all these data valuable. But in terms of outside of traditional care, there's a huge opportunity. And Validic, the way we think about it is we capture all of the data that's happening outside the four walls of healthcare, all of the lifestyle data, whether it's a clinical reading or whether it's a wearable reading. And so what we're doing is we're partnering with all these large companies, like Salesforce and the others that we talked about, by helping them complete the picture of the full 360-degree view of the patient. So they have the EHR data. Now they also have all the continuous lifestyle data outside of the episodes of care. And then they're going to bring all of this in to really paint a full picture and help provide an overall life improvement care, not just healthcare.
Yeah, where they live, where they work, where they pray, where they play. I love that.
That's exactly right.
So Validic has raised close to $19 million in funding right now, Drew, and the largest round you referenced was back in 2015. Couple questions. First, is Validic now operating in the black? And then second would be some of your projections over the next 18 months. Give us maybe some juicy projections that our audience might be able to take in.
Yeah, sure. I mean, as a privately held company, there's certain things that I can and can't say. What I can say is we are very fortunate that we're a stable company. We have really strong revenue. For us, the balance is always between, as we grow, is the balance between research and development and furthering our market position against profitability. Right now, we are really focused on growth in terms of new products, as well as new service offerings and new clients. And so, we're sort of straddling that line of profitability, but I'm continuing to plow my resources into growth so that we can make sure that we're doing the best work that we can for the industry. So Validic does a great job at capturing data from hundreds of disparate sources and delivering it in a way that's actually meaningful. But are there things that we can do that actually help make the data even more actionable? So that's one thing you're going to be seeing from Validic, is that we're going to start to be able to provide services and solutions around, not just what the data is, but the information around the data. So information around data, the difference between data and information. So we provide discrete readings today, right? So, blood pressure readings, glucose values, activity tracker data. What we don't provide today, and kind of how I'm thinking about information, is sometimes the absence of data is actually really helpful information. So the fact that someone didn't take a glucose reading over the last 24 hours, that's helpful information.
Yes,
it's not data.
Yes.
So how can I deliver that information in a meaningful way? How can I deliver the information that there's been a concerning trend over the last 2 weeks? And so that's something that we're thinking hard about. The other thing is, as we look into the different markets and see how folks are using Validic in different ways, we're recognizing that there's opportunities for us to help folks in different sectors. One example I'll give is hospital CIOs and CTOs are in a really challenged position right now because they have their CFO and their CEO saying, "Hey, we need to limit our number of vendor interactions. We need to limit the amount of technology workforce we have, and we need to increase the amount of reimbursements that we can actually provide for our providers in a streamlined way." And then on the other side on the other ear, the CIO hears from their head of oncology saying, "Hey, can we connect a bunch of wearable devices in so that we can start understanding more about the effectiveness of our cancer treatments?" They have their head of endocrinology saying, "Hey, can I connect in some glucose meters or Livongo or Omada Health in order to better understand my diabetic population?" They have their head of peds coming and saying, "Hey, can we connect in Propeller Health to better understand my asthmatic population?" It's very difficult for them to do both, limit the number of vendor interactions and service all of these different stakeholders in a way where there's a common interface. There's a very simple way to actually display and retrieve all this data and have all the data end up in the EHR. So that's the kind of problem that Validic is looking to help build a solution around.
Yeah, it's helping out the workflows and then sort of tying things together. It's not just supplying the data, but then maybe putting some critical predictive analytics and some real insights in as well as to, hey, they didn't do this, they didn't do that. What could this mean? And, now you start to talk about true population health, right? I mean, you're starting to bridge data, patient behavior, consumer behavior, building in a more easily integrated workflow into the CIOs and CTOs of health systems because, at the end of the day, right, it's all about risk. They're going to be taking on more and more and more risk, and they need more certainty. They need more predictiveness. So it sounds like where you're going is absolutely where they need to be and they want to be. The last thing I wanted to ask, Drew, and I asked this of quite a few guests, tell us something to be absolutely true in your mind and heart, but that very few people agree with you on?
What I know to be absolutely true is that we do not need more innovation in order to have patient impact in digital health. As an innovator, as somebody who lives on the bleeding edge and adopts new technology every chance I get, it pains me to say that a little bit, but the reality is what we need to actually do is apply our innovative concepts in healthcare to integration. We need to be innovative about how we integrate. One example I'll give is in 2005, we had a smartphone that did everything that your iPhone or your Android phone does today, almost everything, and that was the Palm Trio. The Palm Trio, it had a touchscreen, it had Bluetooth, it had you could sideload apps, it had a camera, it had a video camcorder, it had email, it had texting, it did all of these things that we do today. The problem is that it was a real pain in the ass to use, and it was not something that was very, very focused from a design perspective. It was very difficult. The iPhone came out in 2007 and really hit its stride in 2010, and since then, everybody has an iPhone or an iClone, right? And yep. the reason is because it's a fully integrated stack. They're super easy to use. Everything works well. And what's interesting is that Apple did not innovate on the actual functionality of the Palm Trio. It's basically the same function, especially the first version of the iPhone and the Palm Trio, basic same functionality. It looked better, but the design of it, the innovation was all in how they integrated things. And by the way, I don't know if you remember this, but the first year, the iPhone was only available on AT&T. Do you remember that?
I sure do. It was limited. Absolutely.
That's right. And the reason was because Apple actually paid attention to how the phone integrated with the carrier. They actually caused the carriers to change how they even integrated with phones and how they thought about phones and how they worked with consumers to onboard phones. So Apple didn't just come out with a Me Too phone and put it out there and then people adopted it like crazy because it's Apple. Apple took all of the work on the back end and said, what is going to be the experience of the consumer in terms of, when they buy the phone, when they get the phone hooked up to the carrier, when they get the visual voicemail, when they do all of this work. And so if we could apply the innovation on integration the same way Apple does, right? The same way that they apply, how do people actually use this? If we could do that in healthcare and put all of our focus on the integration of these things and the integration of the features, not the innovation on new data, I think that we'd be in a much stronger position. I think that we'd be able to create a healthcare system that actually worked for the patient as a consumer and made it something that was very, very simple and effective to use.
Drew Schiller, CEO of Validic. Drew, a great interview. I know our audience really appreciates your insights and the power of your vision and the solution. We wish you and your company the very best moving forward.
Thanks so much, Steve. Really enjoyed the time.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.